It has an impact on the baby as well. It can cause complications in the pregnancy to the baby and to the mother. So it's very important to manage this condition as well. It is very overwhelming and distressing for the patient. It usually can go unnoticed years and years, causing its effect on the body, complications. So they can be teased about it and they don't know how to handle the situation. Our goal is to avoid the complications.
Good evening, dear friends. Welcome to BMC Global Live Al-HILAL Health World, a talk show with the expert doctors of Al-HILAL hospitals and medical centers, Bahrain. November is a time when people come together to shed light on a condition that affects millions of people, diabetes. Today we will be discussing about diabetes and the realities people face when they live with this condition. And the doctor joining us today is Dr. Aysha Sarwani from Al-HILAL Premier Hospital, Sagaya. She is a consultant in endocrinology. Doctor, welcome to the show.
Thank you so much. I'm Dr. Aysha Sarwani. I work as a consultant endocrinologist and diabetologist in Al-HILAL Premier and in Al-HILAL Multi-Speciality Center in Head.
Thank you for joining us today.
Thank you. I'm glad to be here.
So, Doctor, we are in the month of November, the month of diabetes awareness. So, how do you describe diabetes from the medical standpoint and how common is it globally?
So in simple terms, diabetes is a disorder in which your body cannot metabolize sugar or glucose, which is required for energy for your body to perform. So either it is that there is no production of the hormone insulin that is required to push the glucose from the blood into the cells for them to function, or that the insulin is not enough and the body is resistant to use the insulin for its function, and the sugar stays in the blood and causes disruption of a lot of organs in the body.
Doctor, we know there are different types of diabetes. Can you explain about them in detail for us?
Yes, sure. So there are three common types of diabetes which we call as type 1 diabetes, type 2 diabetes and gestational diabetes. So type 1 diabetes is the disorder in which there is no insulin production from the organ called pancreas. There are various factors for that, but it is an autoimmune disorder, which means that the body's cells has reacted against their own pancreas. So the hormone insulin is very little or there is no production of it. So that means there is no insulin, so it cannot push the blood glucose levels into the cells for them to use it. Then there's type 2 diabetes, which is a disorder of insulin resistance, which means that there is insulin but the body cells cannot use it optimally, or there is not enough insulin. So there can be various factors for that. A person can be overweight, there can be a genetic predisposition, it can be due to eating habits, it can be due to lifestyle habits also. And then there is gestational diabetes or diabetes in pregnancy. So now this type of diabetes is usually diagnosed in pregnancy screening when they are doing tests for the pregnant ladies and they found that the blood sugars are high. This type of diabetes usually will resolve after pregnancy, but then it puts you at risk of developing type 2 diabetes later in your life. Okay. So that's why it's important that this is also managed very well. It has an impact on the baby as well. It can cause complications in the pregnancy to the baby and to the mother. So it's very important to manage this condition as well.
Now, Doctor, can you speak about the early signs of diabetes that people should be aware of?
So there are different signs for different type of diabetes. Now type 1 diabetes usually can hit hard and the signs and symptoms can appear and are noticeable, which can be increased frequency of urination. So a person will start noticing that he starts to urinate more frequently. At the same time, the person will feel more thirst, feel more hunger, and despite feeling hungry and eating more, a person will lose weight. Can have repeated infections also and difficult to heal wounds as well. So these are usually over short duration and a person will be able to notice that, and the sugar levels are then checked and they are found to be high. Now, type 2 diabetes is a silent disease. It usually can go unnoticed years and years, causing its effect on the body, complications, and a person who doesn't test will never know that he has type 2 diabetes unless randomly tested for some other reason and they found, and it's later and high diabetes at that time and difficult to control and reverse the complications, and that can happen. Gestational diabetes usually also runs a silent route until the point where the sugars are tested in pregnancy and they're found to be high.
And who is most at risk of developing diabetes?
There can be different factors that can put people at risk. For example, in type 2 diabetes, there is an ethnic predisposition that will put people at risk. For example, South Asians, Middle Easterns, Africans, they are more at risk of developing type 2 diabetes from a genetic point of view. Type 1 diabetes usually doesn't have a very strong genetic impact, but if somebody has in the family, there is more chance. If one of the twins have it, there is more chance for the others, if some of the siblings, but not exactly a genetic predisposition. Then lifestyle factors play a very important role in type 2 diabetes. Sedentary lifestyle, more urbanization leading to different eating habits compared to that what was before, less exercise, more stress, reduced sleeping hours. All of this can put a person at risk of diabetes, and especially the eating habits have really changed to fast food and sugary drinks and all that, and no calorie restriction. That is really putting a lot of people at risk now. Lesser healthy food options, all of that.
And doctor, what are the tests to be done to diagnose?
So for diagnosis of diabetes, usually there are different tests that we use. So a person can test a fasting blood sugar level, and that has to be done on 2 occasions and 8 hours fasting, and there are levels that will tell us whether the blood glucose levels are normal, which is usually less than 100 milligram per deciliter. And then there's something called pre-diabetes. It's not yet diabetes, but it's beginning of diabetes. That's a level between 100 and 125 milligrams, and then for diagnosis it is more than 126, done on 2 different occasions. There's another blood test which is called the hemoglobin A1C, which tells us the control of 3 months of diabetes of the blood sugars in the body, and if that is above 6.5, it is diagnostic for diabetes and has to be done on 1 occasion. It's rather easy to do, it doesn't have to be fasting, so it's a good way to look for diabetes in the community if they do that test. And then there's another test which is usually the method of diagnosing diabetes in pregnancy, where the females, they are given a sugary drink and the blood sugars are checked after 1 and 2 hours of that drink, and if they are high, more than the cutoff for diabetes, then this is how it is diagnosed, mostly in pregnancies.
You already mentioned about lifestyle habits influencing diabetes. Can you speak about in detail about the lifestyle habits influencing type 2 diabetes?
So type 2 diabetes, mostly, like I mentioned, there is some ethnic predisposition, like let's say a genetic predisposition which somebody cannot change. So this is something that if you have a family history of type 2 diabetes in your elders and in your siblings, you know that you can be at risk of developing diabetes. But will you develop diabetes? Then come the environmental factors in play, which are modifiable. So if you are really certain to follow certain lifestyle changes, you can prevent development of diabetes and you can overcome the genetic risk that you had. So that means first of all, the eating patterns. So if somebody is really avoiding sugary drinks, avoiding high carbohydrate meals and carbohydrates alone, for example in sweets, combining carbohydrates with proteins, vegetables, fruits, all of this, and maintaining small consistent changes in their lifestyle, then they can prevent the meal aspect of the risk of development of diabetes. The second most important factor is exercise. Lack of exercise, even small things, for example taking elevators instead of the stairs can make an impact and can put people at risk of diabetes. It's very important, for example, after meals 10 to 20 minutes of a walk or 30 minutes in a day of a brisk walk, which is recommended, can put your risk of diabetes much less than what it is. Then there are strength training exercises which helps you build muscle and helps you use insulin more. So you don't have to do a lot of all of this, but maybe 10 minutes 2 or 3 times per day is also going to help. Then there's avoidance of smoking, because diabetic patients have heart disease risk. And then there's avoidance of intake of sugary drinks. This can make your impact of diabetes much less. So staying active and maintaining sensible eating patterns is the key. Reducing your stress levels, having a good sleep pattern, at least 7 to 9 hours per day, and doing something to reduce the stress in today's age and time is very important, because an rise in the stress hormone is putting your blood glucose levels high, and if that is constant, then you are putting yourself at risk of diabetes.
And doctor, can you tell us about this impact of stress on the risk of developing diabetes?
What happens is that when the body is stressed, the stress hormones are released in the body which tackle the stress, which is cortisol and adrenaline. These hormones increase the blood glucose levels, so the body has the energy to deal with the stress. But at the same time, a constant increase of these hormones is going to make the blood sugars high all the time. So that is going to have its impact and put the person at risk of diabetes. That is why meditation, whatever form of de-stressing a person can do and knows that that helps a person, is very important. So this is also another important risk factor for development of diabetes.
And coming to the treatment options, how has the treatment of diabetes evolved over the years?
So there has been a remarkable evolution of the treatment of diabetes in the last, let's say, 100 years. So at 1920, it was a disease with no treatment option available at all. And then there was insulin discovered, and that was a lifesaver for people with diabetes. And over time, in 1950s, the insulin became much better. Instead of the animal origin, they could found DNA generated insulin, and then came the era of development of medications. So once the medications developed, there was a treatment available for type 2 diabetes as well. The insulin improved. It used to be small syringes and people had to use that. Then became available the pen insulins. But the remarkable change was in the 2000s era, when a lot more medications became available for diabetes, newer medications which were not there before, medications offering benefit for kidney protection and for heart protection, a lot of benefits apart from diabetes, weight reduction, blood pressure reduction, better for cholesterol. So now the where we stand is very different from where the situation was 100 years ago. If somebody from that time would walk into the clinic now, will be very, very surprised at how we treat diabetes now.
Doctor, we know that a person will be overwhelmed by the diagnosis of diabetes. What kind of support system can you suggest for such people?
It is indeed a very overwhelming diagnosis, especially for the young and the adolescent, and of type 1 diabetes, and it is too much to take at the time of diabetes. So what we tell the patient initially is to have an acceptance of the diagnosis, not to be in denial that this is something that will go away, but this is something that can be managed. So once they accept the diagnosis, then we offer education. Small steps, something they can grasp, something they can adapt, and something they can do for small changes. We don't want a one-day reversal of the whole system to get a glucose control. It is very overwhelming and distressing for the patient. Diabetes distress is indeed a very difficult thing to tackle, especially for the young and also for the elderly. So what is first and foremost is a good physician, a good management team, a good educator, somebody who will give you the correct advice. And then to follow that advice, you need a support team, that is the person's family, let's say, first and foremost. For example, if it's children, then the parents, they have a big role in managing the condition, and they have to be able to support the child, that we understand and we are there to help you to manage it. If they are distressed and the child is distressed, then nobody can really manage the condition. Then there's understanding of what happens if the sugars go down, if the sugars go up. There should be a support system, a team of physicians that are available to guide and to educate regarding these. Then there's a friend support system should be there, support groups should be there. Schools, colleges should have some facilities for supporting patients or with diabetes in their communities. And online and on the internet, many support groups are available now, which people can share their journey, especially type 1 diabetes, of how they are going through. And community support groups are there, creating awareness, screening the people, educating them, telling them about this disorder and how it can impact their health.
Doctor, what are the early signs of diabetes? I mean, type 1 diabetes found in children. Are they the same as type 2 diabetes?
Now, increasingly, type 2 diabetes is becoming much more common in the young and the adolescent, which was not the case previously. It used to be a disease of the older population. Type 2 diabetes can run silently. But what signs can somebody expect is that we expect a person to be overweight, and then can have repeated infections and poor wound healing as well. A person can have some hyperpigmented, darker skin areas in their neck and in their armpits. Skin tags can be available, constant fatigue, constant tiredness, and if there is some infection, it can trigger the other signs as well, like increased thirst or increased urination, or if they check randomly by somebody else's checking, or in community awareness they check and they find. But it can run a silent course for a very long time until future complications then come into a notice, and then it is discovered at that time.
And what are the challenges these children face at school, and how can we help them?
A lot of challenges actually. First of all, if children are small and that age group doesn't understand the diagnosis, so there can be peer pressure, there can be bullying and teasing as well. Now, if somebody is using technology and they have a sensor device, they are using a pump, not everybody would know that what it is. So they can be teased about it, and they don't know how to handle the situation. Secondly, their blood sugars can fluctuate. It can fluctuate due to various reasons, even from stress or from physical activity, physical training, during exam time, for girls during their menses time. Anything can happen, or if they didn't eat, or the break is delayed, or they didn't have their snack, or if they ate too much, so the sugars can drop and the sugars can go high. So it is a challenge. It is so we do give medical reports for the patients, and we educate the schools. Usually, especially in Bahrain, there are a lot of children with diabetes. They are now aware of this condition, and we tell them that the child may need to check the blood sugars, might have symptoms of low blood sugars, might need to eat immediately, should have an access to the washroom, might need to urinate, may be thirsty, should have access for the water, maybe not be able to do physical training. A lot of challenges.
How can government agencies and community help increase awareness about diabetes?
So educational programs and awareness days as such should be held frequently to educate the community about this disorder and the impact it is having. So diabetes societies and all of that, they can have educational programs and educate the teachers, the school staff about this, and to have a backup plan, at least to know that if they have a student with such a disorder, what to expect and what to do. It's not just what to expect, also how to take an action, because immediately they are the one that is in front of the student and they have to take the action. So recognizing the signs is very important. For example, if a student is going low blood sugar, he might be shaky, might not be able to see clearly, maybe sweaty, So somebody should keep in mind that this might be the situation, and you have to give immediately something to eat and then to check the sugars. So education is very important.
And doctor, now can you speak about the long-term complications of diabetes if it is left untreated?
Yes, this is the very important aspect of treating the diabetes, because our goal is to avoid the complications. This is what we explain to the patient, that at the time of diagnosis, you might not realize that this diabetes is causing you any trouble. But the goal is to prevent the development of complications that will develop years later, and that can have a very severe impact on one's life. So there can be a lot of complications. Let's say we'll start with something we call as microvascular complications, which means involvement of the nerves. Different nerves of the body can be involved. It can cause different impacts. For example, a person can get neuropathies. Neuropathy means the nerves are affected, leading to tingling and numbness in the hand and the feet and reduced sensation. Now what that does to the person is that he might not feel that there is any injury to his feet or to his hands, and that can become worse without the person even knowing that he was injured in his feet, and that the diabetes itself causes delayed healing. So that can lead to very serious complications. If wounds are not healed, eventually they lead to amputations or cutting of the part of the feet. So that is one of a very serious complication. It's not rare also, unfortunately. It is very common, especially with advancing age. Then the nerves of the stomach can be affected, and then it can lead to impaired digestion. For example, food is not digested, leading to vomiting and diarrhea. It's one of the late complications and one of the difficult to manage complications. Similarly, bladder dysfunction can occur, which can lead to problems in urination, and similarly in both men and female, sexual dysfunction can occur. Then there are complications in the eye. The retina is affected, and there are different stages of that. Some can be detected early and can be treated, and some are detected late and can even lead to blindness. So the key is in knowing and screening for these complications. Then the kidneys can be affected, which can lead eventually to kidney failure, unfortunately, which is also a serious complication, leading to transplants, leading to dialysis, severely impacting one's life. And one of the most serious complications is the complication on the heart. Diabetes is a big risk factor for heart diseases, including heart attacks and heart failures. It's one of the leading cause of death in diabetes, unfortunately. Over the years, the vessels of the heart are affected in such a way, because of high cholesterol, because of high glucose levels, that this is really inevitable if somebody does not control diabetes. Stroke is another complication of diabetes, and problems in walking and leg pain, and it's all very common. So a lot of complications actually. High blood pressure, high cholesterol, reduced vitamins, many things are associated with diabetes. We try to prevent all of that, look for all of this. We hope that we don't reach that stage in somebody with diabetes, but it's not uncommon, unfortunately, and that's why the education regarding this disease is really common.
And finally, doctor, what is the one key message you want our viewers to keep in mind after this discussion?
So for somebody who doesn't have diabetes, they should know about this condition, how important it is for them to prevent this from happening, and them to take the lifestyle changes now. For example, if somebody has diabetes in the family, they should try to prevent for it to occur to them. Manage their lifestyle, healthy eating habits, exercising, all of that. And for somebody who has diabetes, they should be able to take small steps, effective, consistent steps to improve their diabetes every day, not something very intense in a single day which they cannot sustain. They should know it's a controllable condition, and they should be encouraged to take small steps to improve their condition and to see a physician regularly, so they know where they stand.
Thank you, doctor. Thank you very much for sharing your valuable insights about diabetes.
I appreciate for the opportunity I had here to educate about this condition. It's one of the very common condition in the communities, and it's increasing day by day. So awareness about screening and treating this condition is very important. I appreciate the opportunity to share this information.
Thank you once again.
Welcome.
So viewers, I hope this episode was helpful. For more informative episodes, tune into BMC Global Live Al-Hilal Health World every Tuesdays at 8 p.m. Till we meet again with a new doctor and a new topic next time, this is Jasila Mujib signing off. Good night.